So the other thing we're going to look at or talk about is subjective data and objective data. It's part of the health assessment chapters that we've been doing all along. So some of the things when we're gathering information and we're actually asking health history questions and we're thinking about the nervous system, and I have wrote down page 1345 56-5 is your little box that goes over the questions. We have to think about nutrition. Patients may have facial paralysis because of a stroke. We need to think of elimination. We need to ask them about bowel and bladder habits because it may be a patient who has a spinal cord injury or MS. Activity. We need to ask them about their activity level because if we're talking about neurostatus, these patients are potential risks for falls. Sleep patterns, we want to know if they're having any type of hallucinations or dementia. And cognitive, I like in your textbook it uses the example to ask the question, what is a reasonable price for a cup of coffee to your patient, and have them answer that. And it is interesting because when I think back in my practice, I've had patients who seemed sharp as a tack and with it, and then all of a sudden you ask them this kind of question that deviates from the routine questions, and they give you a crazy type of answer. I remember all the asking someone their name, their birth date, what day of the week it was, all those questions lined up perfectly. And when I got to the president, they told me it was some president who had been president like 30 years ago. But everything seemed so normal in the conversation until we got here. So I think that was kind of an interesting question to use. So when we're asking or assessing and we're doing part of the health history question, you have to think about if you have a younger patient or you have a patient that comes in with a head injury and they're confused, what should you do? So for example, I have a 45-year-old motor vehicle accident patient comes into the ER with a head injury and they're confused. Family is with them. So you don't want to wait or delay treatment, and you need to obtain your neuro assessment, and part of the assessment is probably asking some type of questions. So you're probably going to have to ask the family because the patient's not going to be able to give you the information or accurate information in order to take care of them. You also have to think about, what types of orders would you expect if you have patients and they're coming in and they're presenting symptoms of confusion or they've had a head injury, and why would we want to do an x-ray versus a CT scan. So just a couple of things that I want to point out on this particular slide. This is part of the assessment for the cranial nerves, is when we get to hearing test and we're looking at the acoustic nerve, cranial nerve number 8. There's something called a vibration tuning fork. This is something that, I don't know if you guys saw it in fundamentals, but it kind of looks like, and I am no artist by any means, but it kind of looks like a Y instrument. It's heavy. It's made of metal, and what you do is you hit it against your hand, the palm of your hand, and what that will do once you strike it against the palm of your hand, it will make a buzzing vibration sound, and it can be used to assess the acoustic nerve. The other thing is you can also put your watch up to the patient's ear and ask them if they can hear the watch or the ticking of the watch. So just so you know that there is something called a vibration tuning fork. It's used to assess sensation. It's also used in something called the Weber and Rhine test. And essentially what they do is, for the Weber test, we're assessing conductive loss of hearing. And you take this tuning fork and strike it and put it in the middle of the patient's head and ask them where the sound is coming from, and they need to identify it. The Rhine test, which is actually spelled Rine, is assessing air and bone conduction. So you strike the tuning fork and you put the bottom piece right here, and this is the same piece that you would put at the top of the head for the Weber test. So you put that near the mastoid bone, and you note the time and move the fork or the tuning fork towards the ear canal, and you do that on both sides to assess sound. The next thing I want to kind of point out when we're talking about assessing for coordination and you're assessing gait and balance on patients, which is very important in neuro, is something called the Romberg test. And essentially what you do is you have the patient stand with their feet just slightly apart from each other, and they will extend their hands with their palms up and close their eyes. And essentially what you are assessing for is minimal swaying for 20 seconds. Someone who has maybe a tumor in the cerebellum or cerebellar function, they will have a lot of swaying and feel like they're on a tilt-a-whirl kind of thing.